A new study published in Neurology has found that individuals who experience consistently high or moderate inflammation in their early adulthood are more likely to suffer from executive dysfunction in midlife. Executive function encompasses a range of cognitive skills essential for organizing, planning, prioritizing tasks, regulating emotions and attention, developing time management skills, and avoiding distractions. While various factors can lead to executive dysfunction across different neurological conditions, previous research has linked higher inflammation in older adults to dementia. According to Amber Bahorik from the UCSF Department of Psychiatry and Behavioral Sciences and the Wheel Institute for Neurosciences, long-term studies indicate that brain changes leading to Alzheimer's and other dementias can take decades to develop. Therefore, the researchers aimed to investigate whether health and lifestyle habits in early adulthood could influence cognitive skills in midlife and, subsequently, the likelihood of dementia in later life. The study analyzed data from 2,364 participants in the coronary artery risk development in young adults study. The findings revealed that only 10% of participants with low inflammation failed cognitive tests assessing memory and processing speed. In contrast, 19% of participants with higher inflammation and 21% with moderate inflammation performed poorly compared to those with lower inflammation levels. Senior author Christine Yaffe, a professor of psychiatry and behavioral sciences, neurology, and epidemiology and biostatistics at UCSF, stated that inflammation significantly impacts cognitive aging and may begin in early adulthood. Inflammation likely has both direct and indirect effects on cognition. Fortunately, there are ways to reduce inflammation, such as increasing physical activity and quitting smoking, which could be promising strategies for prevention. The study included 55% women and 57% white participants, with the remainder being black. The mean age was 50 years. Around 45% had lower or stable inflammation, 16% had moderate inflammation, and 39% had higher levels of inflammation. Inflammation levels were measured using the inflammatory marker C-reactive protein over 18 years. 5 years after recording their C-reactive protein levels, participants underwent cognitive tests, with most being in their 40s and 50s at the time. Chronic inflammation is not only associated with dementia but also with conditions like heart disease, hypertension, type 2 diabetes, and depression. Contributing factors to chronic inflammation include smoking, alcohol use, repeated infections, exposure to pollution, and pre-existing allergies. Healthcare providers recommend reducing sugar intake and consuming more fruits, vegetables, and high-fiber foods like legumes and pulses to help reduce inflammation.